So I'll start by washing my hands. Then I'll proceed to introduce myself to the patient. Hi, my name is Bethel. I'm a student. May I confirm your name and details, please?
I'm Joshua, 30 years old.
Okay, thank you, Joshua. So today I've been asked to examine your shoulder. This will basically involve me inspecting, feeling, and asking you to perform certain movements of the shoulder. Is that okay?
Yeah, it's okay.
Thank you, Joshua. So I'll kindly ask you to kindly take off your t-shirt so that I proceed with the examination. So I will start my examination using the look, feel, and move protocol. So I will start by inspecting. So I'll inspect for any obvious scars. And let me see the other shoulder. Any obvious deformities, any deltoid muscle wasting. Kindly face the wall. I'll also look for paravertebral and trapezius muscle wasting. Inspect the outline of both scapula. Check for any scoliosis, there is none. Check for winging scapula, there is none. Okay, kindly may you place your hands and push against the wall. So this will enable me to inspect for a winging scapula, which is due to injury to the long thoracic nerve. So there is no winging of the scapula. Kindly relax and face the camera. So next I'll proceed to feel, which basically will involve me checking for temperature difference from the sternoclavicular joint all the way to the shoulder joints bilaterally. So this basically is just to rule out any underlying inflammatory process which can occur in conditions like septic arthritis. Next will be to palpate the sternoclavicular joint of the right arm. And then I'll feel the clavicle, checking the patient's face for any tenderness or discomfort. Palpate the acromioclavicular joint. And I look for the coracoid process, palpate it, and also palpate for the greater tubercle of the humerus, of the right humerus. I will do the same on the other side. So palpate the sternoclavicular joint, then the clavicle up to the acromioclavicular joint, then the coracoid process and the greater tubercle of the left humerus. I will also feel for the deltoid muscle bulk bilaterally, the trapezius muscle, which is K. So Joshua, I'm going to ask you to just turn and face the wall. So here I will inspect for scapular movement during abduction, check whether there is symmetry or whether there is any weakness. So first I will start by palpating spinous process of the left scapula, and then I'll feel for the border of the left scapula. I'll do the same for the contralateral scapula. So Joshua, I'm going to ask you to bring your hand up to the side and then as far up as much as possible. So this is basically to assess for the various motions of the scapula in abduction. Relax, bring it down. Kindly do the same for the other hand. So there's normal movement of the scapula with the shoulder abduction. Kindly turn and face the camera. So I'm going to ask you to perform certain motions at the shoulder joint. So first I will ask you to bring out your hands in front like this, and then far high up as much as possible. So this basically is assessing for flexion. The normal range is around 180 degrees and he has achieved that 180 degrees. Now bring them back down and then as far back as much as possible. So this is assessing for shoulder extension, and the normal range is around 40 to 60 degrees. So bring them back to your sides and relax. Next, I'm going to ask you to elevate your hands like this all the way up as far as possible. While performing these movements, in case you feel any pain or discomfort, let me know. So next, this is just assessing for shoulder abduction. Usually the normal range is around 180 degrees, which he has been able to achieve. Now bring them back and then across your body as far as possible. So for shoulder abduction, the normal range is around 40 to 60 degrees. Next, I'm going to ask you to flex your elbows like this and turn them. So this is assessing for external rotation. Now this, that is assessing for internal rotation. So these are passive movements. So these are active movements. So in case active movements elicit any pain, we proceed and do the passive movements. So bring your arms back up to your shoulders. So next I'm going to lift your hand up as far much as possible. If you feel any pain or discomfort, please let me know. So I will start with passive flexion of the right shoulder, then proceed to passive extension as I check the patient's face for any grimace. Then I'll move to shoulder abduction, shoulder abduction, then external rotation and internal rotation. I'll proceed and do the same on the contralateral side. So I will start with flexion, extension, abduction, abduction, external rotation, and internal rotation. So all the movements have not elicited any pain or tenderness. So kindly may you face the wall. So hands behind you as far back as much as possible. So this basically is just assessing the internal rotation and abduction. Okay, it's okay. You can face the camera. So next I proceed to do special tests. So the first test is an empty can test, which basically is used to assess for impingement or weakness of the supraspinatus tendon. So I'm going to ask you to abduct your arm, bring your arm this much and then slightly in front. thumb facing downwards. So I'm going to try and push down your hand. Don't allow me to do it. So this confirms the right supraspinatus tendon is intact. I'll proceed and do the same on the contralateral shoulder. So bring your arm out and then slightly to the front, thumb facing downwards. I'll try to push it down, offer some resistance, don't allow me to push it down. So the left supraspinatus tendon is also intact. So next I'm going to assess for infraspinatus tendon. So this will basically involve me asking the patient to flex their elbow. So kindly do this. Arms by your side. Then I want you to push against my hands as far much as possible. So this proves the infraspinatus tendon is intact. So next I'll proceed to do the lift-off test, which basically tests the subscapularis tendon. So I'll ask the patient to face the wall. Your left arm behind your back. Kindly push against my hand as far much back as possible. Okay. Do the same with the other arm. Push back my hand as far much back as possible. Okay. Thank you. Kindly turn and face the camera. So, to complete my examination, I would love to assess the neurovascular status of both upper limbs. I would like to examine the joint above, which is the cervical spine, and the joint below, which is the elbow joint. I will also go through any x-rays or any imaging available of both shoulders. So Joshua, thank you. That completes my examination of your shoulder. Thank you. You can put on your t-shirt. So Joshua, a 30-year-old. So I examined his shoulder. There were no scars. There was no deformity. There was no muscle wasting. On performing the various movements, abduction, adduction, flexion, extension, internal rotation and external rotation, both movements, there was normal range of motion. For the impingement tests, there was no supraspinatus impingement or tendinitis. So this was a normal shoulder joint examination. Thank you, Joshua.